And a very good morning to you. It is Rhema Brekky. Good to have your company. It is that time of the month again. Our very special regular monthly guest, Dr. Clara from Life Medical Centre. He's joining us in the studio this morning. Clara, how are you?
Yeah, doing really well, thanks. Good to see you.
Good to have you on board this morning. And look, another great health topic. This one is very, very common indeed. And we're going to look at macular disease. So the first thing we probably should let the guys know this morning, what exactly is macular disease?
Yeah, so macular disease covers a range of painless conditions affecting the central retina, which is called the macula, at the back of your eye.
And for those, I guess, us laymen, what is the macula?
Yeah, so it might first help to understand how our eyes work, right? So your eye is very much like an old-style film camera. The front of your eye is made up of the cornea, the iris, pupil, and lens. And these work together to focus an image onto the retina, which lines the back of your eye. So it's a bit like a, movie screen kind of thing. And the retina is a light-sensitive tissue that acts like the film in the camera. It captures the images and sends them back to the brain via the optic nerve, and then our brain then interprets the images for us. Now, the macula is the name given to the area at the center of the retina at the back of your eye. Now, this region is very small. It's only 5.5 millimeters in diameter, and it's responsible for detailed central vision. So it means you use it for activities like reading, driving, recognizing faces. It's also responsible for most of your colored vision. The rest of the retina is called the peripheral retina. So that's where your peripheral or side vision comes in. And it's generally not as clear as your central vision, and is used to see general shapes and surroundings. And for our ancestors, it'd be to, look out for the tiger or the lion that's about to jump out and attack you.
Yeah, absolutely. So if people are thinking they may be suffering from macular disease, what are some of the symptoms they should look out for? Yeah,
so conditions only affecting the macula don't tend to lead to complete blindness. So it doesn't cause you to be, to have this complete black vision. Instead, it only impacts your central vision. Mm-hmm. And so that leaves your peripheral vision intact. So people can still kind of gauge what's going on around them. Now, the trouble is you can have early signs of macular disease without knowing it. But when symptoms do appear, they include things like difficulty with reading or any other activities that require a detailed central vision, distortion where straight lines might appear wavy or bent, problems distinguishing faces, or dark patches in the central vision. So if you notice any of these symptoms, you should consult, an eye health professional like an optometrist. And early detection and early intervention are very important to saving your sight.
Yeah, very important indeed. Now, how common is macular disease?
It is the leading cause of blindness and severe vision loss in Australia, so super common. It's estimated that 1.9 million Australians have some evidence of macular disease.
Wow, that is a huge number.
Yeah.
Now, what are the more common types of macular disease? Because we know there are a few.
Yeah, there are a few. So the most common one that you'll hear about is called age-related macular degeneration, or AMD for short. So approximately 1 in 7 Australians over the age of 50 have some evidence of AMD. The next most common one is probably diabetic retinopathy. And so it's essentially a common complication of diabetes, or generally in type 2 diabetes. Sure. It's the leading cause of preventable blindness in working age Australians. So everyone with diabetes is at risk of developing diabetic retinopathy. And the longer someone has diabetes, the greater their chance of developing the condition. And then there are some other slightly less common macular diseases. So that includes things like retinal vein occlusion. So that's where the vein that allows the blood to flow out of the retina becomes blocked. You can also get myopic macular degeneration and macular telangiectasia, which is, just more fancy words for you, but they might be terms that people have heard of.
Yeah, absolutely. Now, given that the most common macular disease is obviously age-related macular degeneration, let's talk a bit more about that, because that's an important one this morning. So what causes macular degeneration?
The cause of macular degeneration is not actually known. So that leaves us all kind of thinking, oh, so what can we do about it? But we do know that it's more common in people who smoke.
Right.
So if you're a smoker, quit smoking. Your risk increases the older you get, and it's higher for people who have close members, family members with the condition. So if you have a parent or sibling who already have been diagnosed with age-related macular degeneration, you have about a 50% chance of getting it.
We are joined this morning by our resident medico, Dr. Clara is in from Life Medical Centre. We'll take a short break and we'll be back right after this talking more about macular disease. Stay with us. Welcome back. We are joined this morning, Rhema Brekky, with our great friend and, of course, our regular monthly guest, Dr. Clara from Life Medical Centre. We are talking this morning about macular disease and I guess everything that goes under the umbrella of that term. Now, how is macular degeneration treated?
Well, sadly, there is no cure for macular degeneration, but there are some highly effective treatments for one of the types of macular degeneration called wet macular degeneration. And so regular injections at first monthly, then later up to 3 monthly of a medication called anti-VEGF medications get injected into your eye, and that can prevent further loss of your sight, with the hope that people can maintain their independence for as long as possible. There are no treatments for other types of macular degeneration. The other one is called dry macular degeneration. But we do know, as I always say here, healthy diet, regular exercise can slow the progression of disease. And some eye specialists will even recommend certain vitamin supplementation to assist with that.
Sure. So how can, I guess this is leading into the next question, how can you prevent AMD?
So my recommendation would be have regular eye exams, including a check of your macula to make sure that, if you've got something that's starting, that we pick it up early. This is especially important if you have a family history of macular degeneration. Now, Medicare does subsidize eye tests that's provided by optometrists. And so you don't need a doctor's referral. You can just pop into any of the local optometrists that you see at the shopping centre to get that done. And the whole idea is that you may be able to reduce your risk of developing age-related macular degeneration or stop the vision loss from progressing. And you can do that with lifestyle choices as well. So the first thing we spoke about earlier, not smoking.
It's a big one, isn't it?
It is.
It just affects so many things in the body.
Yeah, absolutely. And then the second one is making sure that your blood pressure is within the normal range. So the recommendation nowadays is for blood pressure to be less than 120 on 80, being checked on a machine. Eating a diet that's rich in fruit and vegetables and omega-3 fats, which are the healthy fats. And then, attempting to live a healthy lifestyle by maintaining a healthy weight, exercising regularly. They're all things that help to keep the body moving well.
Yeah. Now, what should you do after you get a diagnosis of this?
Yeah, there are a number of things that you can do. So firstly would be to seek advice from your eye health professional. So whether that be your optometrist or your ophthalmologist, if you have one, making diet and lifestyle changes to slow the progression of the disease. So, said it here many times before, plenty of fruit and vegetables, plenty of natural products, staying away from things that are processed and those kind of things are always helpful. Being active and, exercising regularly and maintaining your existing social activities and learning to do things in new ways. Just maintaining that social contact and letting your family and friends know what's happening for you can go a long way in just providing support for someone who's been diagnosed with it.
Yeah, sure. So what is the outlook for people with macular disease?
Look, fortunately, most patients with macular degeneration can keep good vision for their entire lives, even though even the people who lose their central vision, they've still got their peripheral vision, which they can see with. So obviously it's not going to be good enough for driving, but from a functionality point of view, a lot of people find that, they can still work with that.
Sure. And just in case there is a diagnosis of macular disease, what type of support is available for people?
There is a free national helpline through the Macular Disease Foundation Australia. So wonderful website, loads and loads of information. And they've obviously got professionals who are ready to support you over the phone. They offer information, advice, and support on a full range of macular conditions. And this service is available to people living with macular disease, their families, as well as their carers.
Yeah, some very, very important tips and advice there from our resident medico this morning, Dr. Clara Chu. Great to have you in this morning, Clara. And looking forward again to another month down the track, which we'll be getting into more health. It's Rhema Brekky. Stay with us. More after this.